below for that to hold well. Now, if with that knee I can make somebody sit down cross-legged, I may not be able to do that very well with this. So therefore, in the first place, if somebody needs an operation and I could do a smaller operation, I would always plan to do that. Going on from there, what are the different treatments we can think? Arthritis, as you know, I'm not going to go into the details of arthritis because it would get boring there. It's all about the smooth surface of the joints, that is the cartilage lining of the joint going away. When that goes away and you start getting friction in the spectrum, is when bone defects would happen and people would get deformities. So if somebody has a very severe deformity and is walking with an instability, that is the time, I mean, you see them all around, that is the time when a joint replacement is inevitable. But just knee pain and no deformity, there has to be something else going on. Now, we don't need computers and x-rays to tell us that. We can simply examine and tell patients with, checking their walking styles, more than anything else. So, in the early stages of arthritis, we really can adopt integrated approaches, and we will be talking about that. That is why my colleague is here, and he will be talking to you for 5 minutes at the end of it. That is the role when a lot of all our allied systems of medicine and principles in Ayurveda and the other systems of medicine have a great role. This is where people should be educated right in the beginning. And what I meant by saying about COVID and younger people getting arthritis, we have a lot of people working from home these days. They don't sit on traditional wooden chairs like we were brought up with. Nowadays, people slouch on sofas and are sitting with laptops like this all the time. Our children who are 10-year-old are not used to even, we got television probably when we were 15 years and later. Nowadays, our 2-year-olds are much better at handling mobiles than we are. And all the time people have postures like this. These are things which probably are going to affect us in our young adulthoods and probably going to cause arthritis later. That is what we got to look into. In early stages of arthritis, what we have when the cartilage is not entirely worn, we have a lot of exercise treatments that can be given. There's a lot of pain relief measures in various Ayurveda treatments that is there. In allopathy, we don't have medications at that stage. What doctors, often physicians do is give painkillers. Now, painkillers are okay on a temporary basis. As a surgeon, I don't prescribe painkillers because I would rather teach them lifestyle modifications, exercises. Painkillers will take care of inflammation, they will take care of swelling. So at best, they are only for a few days. The patient has to take things on board. What we can give to them is education. Education about making their muscles better, education about making their postures better, and that is where they might be able to reverse some amount of arthritic change. What we have is, therefore I put it up as the movie thing. There are 3 different types of injections that can be put into joints, but these are specifically going to work in areas where the cartilage is not totally damaged. So in cases of inflammation, where there is a lot of swelling, effusion, that is where steroid injections can work. They will work. These are conditions where the joint may not be arthritic, but suddenly you get a flare-up sometimes. You get an inflammatory kind of flare-up, which is known in osteoarthritis as well as inflammatory diseases like rheumatoid, etc. So that is where it works. In cases with early cartilage damage, we have artificially created, earlier they were created with chicken proteins because it was collagen supplementation. Now we have bacteria-derived genetic recombination. It's called hyaluronic acid, so very high molecular weight, which is substance similar to the synovial fluid. Now these materials will stay in the joint when 6 months. Again, This is for early to moderate arthritis. If the patient does their exercises and strengthens the muscles well, they might be able to prolong the effect of that. So I have had in specific conditions these kind of injections having benefits even for years, provided the patient takes things on board. What often our patient wants is easy things. They want easy medications. They will take medications easily. You tell them to go and exercise. Whatever it is, they come back later for an operation. So then at least I don't blame myself. They're responsible for their own outcomes, isn't it? The third kid on the block is something called PRP, or platelet-rich plasma. Now this has been advertised a lot. There is a lot of cell therapies out there. So this is a new branch of medicine which is coming up called regenerative medicine. What we are doing with cells is we are trying to extract centrifuge good effects from cells. That is, platelets are involved in blood clot formation, scar tissue formation, healing. So there's a lot of healing factors which are concentrated. Also in blood we have white blood cells which have inflammatory mediators in them. So with good centrifugation techniques, if we can get less WBCs and more platelets together and inject platelets in the right place, those give more healing factors without getting the inflammatory factors of WBCs, which is where in the right stage those can make a difference. There's a lot of commercial things going on about stem cells. I will tell you about stem cells. Stem cells are something still experimental. So I don't believe in just injecting any bone marrow or stem cell concentrate directly into the joint, because we don't have long-term results of it. A stem cell can grow into any kind of cell. So if you just push it into a joint without it being focused properly, it could probably grow into a tumor also. But at the minute, there's a lot of advertisements, things going on, lots of even PRP. There are at least 15 to 20 products of PRP available out there, right? Ranging from, you can centrifuge and make your own PRP, because what is PRP? You're centrifuging your own blood and putting it inside. But unless it is standardized, a kit has to be standardized to be able to separate platelets from white blood cells. Otherwise, if you just take any centrifuged blood and inject it in somebody's knee, you can get white cells, and that can become an infection-like picture, like a septic arthritis picture. So the patient will not thank you for it. Things like these can cause sudden anaphylactic reactions. So if you inject any of these initially, it's got to be in a hospital environment. It's got to be a standardized kit, because there are lots of things available out there, and understand the principle before going into it. Next, understanding various conditions can help us diagnose and prevent arthritis early. Now, this is a chap who had an injury to the knee, a very young man, 40-year-old man, who was wearing that kneecap. As a knee surgeon, I think that kneecap is work of the devil. So that can make an injury get neglected. Somebody can walk with an injury, any injury, if it is neglected for 3 to 4 weeks and pain persists. The body's healing mechanisms should allow any basic sprain or ligament injury to heal within 3 to 4 weeks. Somebody wears a kneecap, that kneecap helps the brain more than the knee, and they're walking around like that. They don't realize that the problem inside is compounding. The kneecap, in addition to, it might help the brain, help reduce the swelling temporarily for 1 or 2 days, only be harmful. Because with putting pressure on top of the knee, it also makes the muscles waste. When muscles waste, knee injuries and cartilage damage compounds. So what was inside this guy? He really needed a good examination. You can see just lying down on a couch, you can see this is touching the couch down below. This is not. It's a locked knee. He had not been able to straighten his knee for 2 months and not realized it. Now, that is a picture into a keyhole picture. So an arthroscope with a 4mm incision has been put into the knee. In between the femur and the tibia, you need to have a meniscus. That meniscus has been flipped, it is torn all around, and it is stuck in the inside. So every time he was walking, he was actually sandwiching that meniscus. So if it remains flipped like that for more than 2 months, it can never be repaired again. Fortunately, we got it in the right point, and with the right techniques, we are able to suture it. We were taught that, and 90% of people who still call themselves arthroscopy specialists are actually just taking out that meniscus. So a lot of commercialization out there, but true specialization is very important. So any center where we do keyhole surgery, we should be able to have techniques for repairing it. They can be expensive, there are cheaper methods also. But if we save and we are able to repair that meniscus, that can actually give them back a normal joint and prevent arthritis. Now, many times this is taken out. If it is taken out, the symptoms will go at that point, but the knee will remain without shock absorption and they will develop arthritis 10-15 years later. So it's not good for meniscus to be taken out at 40 because they'll get arthritis at 50. Now, what do many times young people get? This is a common injury which many of our young boys get between 15 and 25. They have a football injury, they don't realize. X-rays many times show normal, because X-rays will show only bone fractures, but they are having symptoms. So if symptoms continue 2 weeks or more, 2 to 3 weeks or more with persisting swelling in a young person, don't neglect it. This is basically like a car in a minor accident undergoes a dent. This is a surface fracture. So if it goes to the bone, on the X-ray we might see a very small wafer of bone. If that is neglected, if it is detected, it can be fixed with keyhole surgery. So this is a small fragment which I was able to fix by just shooting like a dart in keyhole surgery. If something like that gets neglected, that becomes a crater on the bone. Now you can imagine the road from here to Mangalore, we got half an hour late because the road was like that. If it was one patch, it can easily, you could do a patchwork. But if the road is like that, you can't do patchwork on the road. You have to make the whole road again. So if cartilage goes in a small area like this because of an injury, that is like a cartilage ulcer. If the rest of the cartilage is fine in somebody who is 35, 40 and younger, we can do stem cells in this kind of case. What we do is, stem cells, by the word stem cells, are not legal. That is just experimental. What we do is we take bone marrow, there's a specific method described, we centrifuge bone marrow, get the stem cells, or rather the precursor cells from the marrow, and there is a technique arthroscopically. By using glue, we put the stem cells in that area, make sure they don't spread around the rest of the joint, and that helps regenerate cartilage. We can extend it further. Here is a young girl who had, due to cancer treatment, a lot of steroid with parts of the bone undergoing osteonecrosis. Small incision, you can see a big hole where the cartilage is gone, but the rest of the cartilage is normal. What have I been able to do? I have gone to the area on the side of the knee where the joint is not weight bearing. We can take parts of cartilage from there, and in the next picture you'll see there are ways we do along with the cartilage pieces. I've done some patchwork along with the bone marrow. There is a specific way, like I said, we mix with fibrin glue. We have done this patchwork, and around that we have, with the fibrin glue, used those stem cells. So we have covered that whole area with cartilage forming tissue. This is called biological knee replacement. In the right indications, that was a 15-year-old girl, we managed to take care of that defect, because within 5 to 10 years she would have become badly arthritic at 25. This is the way we were able to grow cartilage and make her walk normally. So all these techniques are there. That is the end. This is cartilage from the non-articular area over here, where we can expand it, and covered it with a patchwork-like piece, and the remaining part we used the stem cell gel. So things like that are possible in the right way. We have actually been the first center in India to got recognition by International Cartilage Regeneration Society when we set up as a center of excellence. So stem cells are basically what we are using it. We can use it to regenerate cartilage. We can use it to regenerate bone. We can use them to regenerate any tissue depending on where the situation. but they've got to be used in the right area, in the right way, not just inject them anywhere as advertised. So those are various techniques known. Now, this is a case of stem cells being used in the hip. You can see a lot of people post-COVID, particularly, we are seeing young doctors and many other people getting these. You've all heard of hip avian. So, this person did leave it till a late stage. He's only in his 30s. So, you can see the head, which is round. Over here, there is a little bit of irregularity. It may not be that clear, but here the head has already collapsed. It is quite obvious in X-rays. Many of these things, people go and do MRIs, and the MRIs reports are about 20% of them do get errors. But in a good hip surgeon's experience, we can very well diagnose that on X-ray itself. That and that as a combination, I can see the joint space here is not entirely concentric. On the other side, I can see a cyst in the bone, but the surface of the bone is okay. So he was advised having hip replacements bilaterally because he was in a lot of pain. But in cases where the bone has not collapsed, I am able to actually drill it, take the dead bone out and replace it with the same type of stem cells where I can make bone regenerate. On this side, I've had to replace it with the hip. I have no concerns if I can prevent hip on one side. You can see that head which was collapsed there. You can see how a collapsed head looks. So it is exactly like our old mud houses. If the pillar of the house, which is wooden and with the mud roof on the top, if the pillar gets termites, you can replace the pillar. But if the roof falls and water gets into a mud house, then the whole house has to be reconstructed basically. So it's basically preventing is treatment at the right stage. Now, more than that, there are various other technical things. Here is a young person who's got one side quite bowed. You can clearly see the difference. So they are walking like that with one side bowed. People, because of multifactorial reasons, genetics and everything else, often, even at 50, a total joint replacement is advised. But if there is disease only on one side and the rest of the joint is okay, we have a technology of what's called partial joint replacement. Now, this is a much smaller operation, much less risky, much faster outcome, and feels entirely like a normal knee. A knee replacement will feel better than an arthritic knee, but it will be clicking once in a while. So a patient has to be well motivated. But this type of operation feels like a normal knee. Now at 50, I want to prevent a joint replacement, because if I do a joint replacement, which is an option for this, at 50 years, that patient will require to have another operation when they're 70 and still young. But if I have to do two operations eventually at 50, because one metal may not last 50 years, if I do this, I can easily change that to a total knee replacement at when the patient is 70 or 75. Now, if the same person is a manual laborer, I still won't do this. There are options of realigning and decreasing the pressure in that joint. So various options are there in the right indication. So each person is a study in itself. We have to see the factors, the character of that knee and the character of the patient in deciding the treatment. When it comes to hips, like I said, MRIs, X-rays are all there, but with a right examination, with assessing X-rays itself, like, we can see lines, we can see them crossing, and nowadays we get more information on X-rays if they're properly done. It's not about doing X-ray or MRI. Whatever is there should be done properly and interpreted properly. That is important. Now, when it comes to stages of treatment and treating the patient, I'm just reiterating what Dr. Gokhale said. Who will go to one doctor, not be satisfied, go to another doctor. So there are various stages of treatment, as they say. So they will go to one doctor, they will take second opinions and still not be satisfied. So it's about education and counseling, and many times spending, you have to be passionate about what you're treating, getting to the root cause of the disease and treating the preventive elements. you have to treat the mind as well. People often get satisfaction in the fact that having a disease will get them sympathy from other people, and that itself becomes a gratification. Now, that cannot be helped with surgery. Again, that has to be motivation. At the end of the day, we can't just fold our hands and expect that to be wonders. Even God has said we have to help ourselves, then God will help us. So, to summarize, I will say, I'll pass it on to Dr. Vishwaranjan Das. The essence and what I think is service to society, more than treating knee replacement properly, is trying to diagnose the arthritis early and see if we can prevent it. My colleague, Dr. Vishwaranjan, will tell us a little more about what we are doing to try and prevent arthritis.
ಸತ್ಯ ಸ್ಪಷ್ಟ ನೇರ ಸುದ್ದಿಯೊಂದಿಗೆ UPlus TV. ಇದು ಹೊಸತನದ ಸಂಕಲನ.
ನಿಮ್ಮ ಆರ್ಥಿಕ ಬೆಳವಣಿಗೆಗೆ ಸುವರ್ಣಾವಕಾಶ. ರೋಹನ್ ಸಿಟಿಯ ಕಮರ್ಷಿಯಲ್ ಪ್ರಾಪರ್ಟಿಯಲ್ಲಿ ಇನ್ವೆಸ್ಟ್ ಮಾಡಿ ನಿಮ್ಮ ಫೈನಾನ್ಷಿಯಲ್ ಗ್ರೋತ್ ಖಾತರಿಪಡಿಸಿಕೊಳ್ಳಿ. ಇಂದು 50 ಲಕ್ಷ ರೂಪಾಯಿಗಳ ಹೂಡಿಕೆ ಮಾಡಿದ್ರೆ ನಾಳೆಯಿಂದಾನೇ ಪ್ರತಿ ತಿಂಗಳು 32,000 ರೂಪಾಯಿಗಳ ಆದಾಯ. 75 ಲಕ್ಷ ರೂಪಾಯಿಗಳ ಹೂಡಿಕೆಯೊಂದಿಗೆ ಪ್ರತಿ ತಿಂಗಳು 47,000 ರೂಪಾಯಿಗಳ ಆದಾಯ ಗಳಿಸೋದು ಗ್ಯಾರಂಟಿ. ಮಂಗಳೂರಿನ ಪ್ರೈಮ್ ಲೊಕೇಶನ್ ನಲ್ಲಿರುವ ಅತ್ಯುತ್ತಮ ವಾಣಿಜ್ಯ ಮಳಿಗೆ ರೋಹನ್ ಸಿಟಿ ರೆಸಿಡೆನ್ಷಿಯಲ್ ಅಂಡ್ ಕಮರ್ಷಿಯಲ್, ವಿಜಯ್, ಮ್ಯಾಂಗ್ಲೋರ್. ಹೆಚ್ಚಿನ ಮಾಹಿತಿಗಾಗಿ ಕರೆ ಮಾಡಿ 98454 90100.